Today is International Rare Disease Day. It's interesting because we are calling it a rare disease and yet it's an awareness day. The reason being that what we think that a rare disease is rare, these diseases are not so rare. As per US consensus, it is known that every 1 in 10 person might have an association with a rare disease. So if we extrapolate that to the Indian population, it definitely means that a rare disease is not as rare. What are rare diseases? These are diseases which are basically not commonly diagnosed, or these are diseases which we are not commonly aware of. ICMR says that incidence of 1 in 2500 can be taken as a rare disease. Now, what makes these diseases so difficult is that it is very difficult to diagnose, as they mimic normal condition and yet they have a different etiology. Now, most of these rare diseases have a genetic underlying reason. Now, 80% of rare diseases will have a genetic etiology, and based on that, in an average, a person in US would take about 7 years for diagnosis. But in advent of the genetic diagnosis which is available now, the technologies, this has changed. And so has our situation, and so has our awareness. In view of this, we can definitely tell you that India is known to be a melting point of genetic disorders based on the different marriage practices like endogamy, consanguinity, and hence WHO has stated that India is probably has more risk for non-communicable disorders than communicable disorders. Now, most of these disorders, as we know, they are genetic disorders. They don't have a cure. What we have is management. So early detection, early diagnosis is very important. Also, what is important is prevention. So if we can prevent the disease burden also goes down. Hence comes the importance of genetic diagnosis. Now, if you are a woman, or if you are a family where you are planning a pregnancy and you have advanced maternal age, you have a stillborn, you have a neonatal death in your family, somebody in your family was affected, you have intellectual disabilities, epilepsies, autism, any neuromotor, neurodevelopment or neuromuscular issues, then you might want to speak to a genetic counselor. Also, if you have hereditary cancers in your families, also if you have a baby who was previously affected, or you had a fetus who had an abnormal ultrasound, all these indicate for a genetic screening. Also, many children who have cerebral palsy, autism, there is a chance that this can also have a genetic background. So in all these cases, we can maybe make a diagnosis, but in very few of these cases we can actually give a cure. But management is the standpoint. To know more, you can ask your clinician, or you can ask your medical geneticist near you. In Bhagirathi, Neotia, we do have such a genetic clinic, and you can ask your questions for screening, and also if you have a child who has certain issues.